Hello everybody. Today we are going to discuss about chickenpox or kid. It's a very common illness caused by a virus called varicella. Starts with red palms, then becomes small yellowish blister affecting the whole body, including mouth and genitals, which can be very painful. Then they open before scabbing over. These are very itchy and can make your child miserable. They may have a temperature, a cough, a runny nose. Children are able to pass the virus to others from day before the rash appears until the last spot has capped over. Chickenpox rarely needs treatment unless in a newborn baby or a child with weak immune system for different reason. Um, so basically, um, how can help your child is important to know. So basic seeing your child unwell with chickenpox can be distressing for parent. Using no treatment provided itself and simple things you can do just like keep paracetamol for temperature pain and histaminic for itching or sleep. Plenty of drink, ice lollies, calamine lotion you can use for each. Packed dry after bath rather than rubbing for comfort. This or the loose cloth don't keep an ibuprofen or aspirin unless it is advised by doctor. Cut nail and apply hand mitten in the night to reduce damage to the same. Avoid too much scratching if possible. Now, how long it lasts? This chicken pox is basically a past- last spot. Usually, last spot has crested over 5 to 7 days after the rash first appeared. Highly contagious until spots are dried and scabbed over. Avoid nursery school 5 days after rash onset until all spots are fully scabbed over. Avoid contact with newborn babies, people with weakened immune system, and pregnant women until all of their spots has been scabbed over. If concerned regarding this, contact your GP. Now there is also a vaccine available to prevent catching and spreading disease, not part of the standard vaccine program. Who has increased risk of chickenpox and also those family member risk of complication, they can take it privately. Now, I will tell us some of the features you have to look and you have to take care accordingly. For example, red signs, blue lips, breathless to talk or eat, become pale, mottled, fast abnormally, it feels abnormally actually cold to touch, extremely agitated, confused, lethargic, and develop severe headache, neck stiffness, and balance problem, had feed and seizure, had a rash that does not disappear with pressure, just like glass test. So basically, you have to go to hospital emergency, any department, or call 999. Now, amber sign is that increasing pain and redness between the spot. New blistered spot appear after 7 days. Temperature for 5 days or more. Seems dehydrated, sunken eye, drowsy, no urine passed for 12 hours, rash spreading to the eyes, has extreme shivering and complaints of muscle pain, is getting worse of if you are worried. A parent is pregnant and has not previously had chickenpox. Contact with pregnant women who have not previously had chickenpox. Person with weakened immune system who has not previously had chickenpox, and a newborn baby. The contact should seek advice from healthcare professional. So that time you have to call GP surgery or NHS area 111. If this worsening syndrome, you cannot contact anyone and worsening within 4 hours, you have to go to the emergency. And what I mentioned that none of the features are there, in that case, you can care the child at home. I already mentioned about some of the general thing you can do. But if you are concerned, you can talk to your health visitor or local pharmacist or dial NHS 111. Avoid nursery or school for 5 days of onset of the rash and until all spots fully scabbed over. So these are the things you have to remember. It is very common, but we have to note the serious things, whenever it appears, you have to go to the healthcare professionals and take the help. Hope this little talk will help to increase awareness about among you all about chickenpox. We'll come with the next topic next week. Bye for today.